now I want to introduce our next speaker. I have worked with Senator Hatch for many years on various healthcare commissions, and he was probably working on this long before I was. I can remember when he was talking about navigators and exchanges before we ever heard of Obamacare. So, and I know it's been a priority for him to try to get health care coverage for everybody in Iowa. So without further ado, let me introduce State Senator Jack Hatch.
Well, I just want to make sure you know who I am. I'm Jack Hatch. I'm a recovering politician. You know, we're absolutely right. This is not about us. And it shouldn't be about us. It's about single mom, small business person, an elderly person, friends and neighbors, maybe relatives, and in some cases ourselves. This is about making sure that we have health care security. And I am, for one, since Thursday evening, real happy that the governor has finally submitted his plan, because now we can compare the two. We've known for weeks what we thought he was going to do, but now we know for sure that Governor Branstad has absolutely no clue on how health care can be delivered. You know, some of you I know, some of you I don't. But I look in this audience, I see Teresa Baumhoff. Teresa has been working on mental health reform forever. She's one of the most articulate, thorough, and significant advocate for mental health in this state. She keeps us honest. She keeps everybody honest. For 3 years, we've been working on a mental health reform bill that would standardize services all across the state. Would have a statewide system that's regionally administered and locally delivered. We standardize the money so everyone knows how much they're going to get. We have professionals in the field who are going to deliver that treatment. And we worked hard in working with our counties to make sure that we will not leave them behind. So we went through a rather sophisticated process of convincing the supervisors and a lot of the treatment providers that our bill and our system that we have passed is worth it. You know, politicians say, trust us, and everyone laughs. Well, we said trust us, and the county supervisors did trust us. Now, what does this governor do? To fund his version of health care reform, with $164 million of Iowa taxpayers' money, he scoops $44 million from the county property tax levies of 99 counties to pay for something the federal government will pay for us.
That's right.
And that is not right. It's not responsible. It's not fiscally responsible. And I can tell you that there's no Democrat, and we're going to work in the House next week to make sure that there's no legislator that's going to support that.
Yeah.
He also takes the formula for Polk County's Broadlawns Medical Center and scoops that money without guaranteeing anything to Polk County taxpayers that they will get the same level of service. What we have here is a politician who has forgotten why he's there. He's representing other interests, and we're not quite sure what they are. Because in our bill, we have 78 agencies supporting the Senate-passed Medicaid expansion. On his bill, no one is supporting his proposal. So we have an opportunity, and that's one thing we have to look at. We do have to remember it's about our families, our small businesses. It's about people. It's about a grandmother and grandfather who last year had to give up, who had custody of their grandchildren, went on retirement, and their 25-year-old grandchild now is waiting for Iowa care, and she gets in, but she doesn't have mental health services. And so she's retreated back into the recesses of her mind, which is what the problem was. We had someone who was getting healthier, and now she's getting sicker. That's what Governor Branstad's proposal will do. So it's about people, but we now know the target. We have the House of Representatives that will take this up next week. and they're going to have 2 or 3 weeks of looking at this. We need you at those public hearings. We need you to send to your lawmakers, your Democrats and your Republicans, your feelings about what this means to you, but what it means to us as Iowans. A lot of us are already covered, but we feel as passionately about this as people who aren't. A lot of us believe that some of our colleagues have given up on the greatness of America. Our bill, the Senate bill, understands that we still believe in the greatness of America, that government is here to solve problems. Not problems by themselves, but in partnership with providers and hospitals and with patients. So this rally here and the other ones that you're holding over the week reminds us not only of what we're fighting for, but it reminds us about the future of our state. And for that, and both of those reasons, that's worth fighting for. Thank you.